my whole life, I've been very active. It's just part of who I am. When I was in high school, there was a 2-year period where I was on crutches. Once I recovered from that, I resumed my activities. I was doing all the things I basically wanted to do until I started experiencing pain in my hip. Anything I was doing was painful. Sitting, standing, even laying down, you're not able to rest a hip. By the time I healed my hip injury, my knees were already starting to act up. There was no downtime. It went from my hips healing to my knees being very bad. I just felt like every time I get recovered from one thing, now I'm dealing with another thing. There was always another one coming.
It affected the quality of life like you wouldn't believe. The normal activities which we consider normal of cleaning the house or feeding the dogs or going rollerblading, because she likes the physical stuff, she likes to ski, she likes to do all this stuff, is gone.
My husband had to take over all the responsibilities, period, of everything, of taking care of the kid and taking care of the dog and taking care of the house and everything.
And she didn't really like missing my school stuff. Like, she missed probably a bunch of music shows, and she missed my test day for my black belt in 6th grade.
And so yeah, that was a huge impact on our family, specifically her, and she wanted to change that because it was affecting her quality of life terribly.
I think I saw at least 3 different doctors. 2 of them said to me, come back when it's worse, we're not gonna help you. I mean, literally, there's nothing we can do for you. And I did think to myself at one point, how can this be the rest of my life? I mean, how can I do this?
When I met Britt for the first time, she was a good candidate for joint preservation, as opposed to joint replacement surgery, where many times individuals have to modify their activities. If we can treat orthopedic problems by joint preservation, helping people keep their own parts, so to speak, then they can generally maintain their desired level of activity.
The reason that this custom joint preservation plan that Dr. Henry performed was successful was because it's just what I needed. I didn't need my whole knee replaced. I didn't have to recover from a whole knee replacement. Once I had the procedures and healed from them, I'm back to doing whatever I want. And my restrictions that Dr. Henry gave me were no restrictions.
What he did for Britt and our family has brought us back to normal, everyday activities which we took for granted. And until they're gone, you don't know. And the biggest thing is for when my daughter and my wife get to go skiing again, it's all worth it.
I think the surgeries were definitely worth it because I got my mom back, and now she's just go, 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 no limits, and unstoppable.